Disability is part of the human condition. Almost everyone will be temporarily or permanently impaired at some point in their life, and those who survive to old age will experience increasing difficulties of functioning. We will define the term disability and look at the language that should be used when writing about, talking with, or talking about people with disabilities. We will also look at the types of disabilities and discuss the various teaching methods and materials that can be used when working with patients with sensory, learning, developmental, mental, physical, and/or communication disabilities in Lesson 9. There are several ways to define disability, but the most influential is the social model, which embraces disability as a normal part of life and addresses social discrimination rather than the disability itself as the problem. The World Health Organization, WHO, defines disability as, quote, a complex phenomenon reflecting an interaction between features of a person's body and features of the society in which he or she lives, end quote. U.S. Social Security Administration defines disability in terms of an individual's ability to work for an extended period. The Americans with Disability Act was established in 1990 and extends civil rights protection to disabled Americans as defined as a physical or mental impairment that substantially limits one or more major life activities. The educator must take into account the nature of the disability, whether it is short or long term, the client's support system, readiness to learn, barriers to learning, learning style, and goals of the patient and family. Types of disabilities include sensory deficits, learning disabilities, developmental disabilities, mental illness, physical disabilities, communication disorders, and chronic illness. Approximately 30 to 48 million Americans have hearing loss in one or both ears, and this is expected to increase to 53 million by 2050. It may be congenital due to trauma, such as loud noises or sounds, or caused by disease or infections. Several communication techniques may aid teaching and learning. They include American Sign Language, ASL, lip reading, written materials, verbalization by the client, sound augmentation from hearing aids, or even turning a stethoscope around and speaking into it, and telecommunication devices for the deaf, TDD. Federal law requires that health facilities receiving federal funds secure the services of a professional interpreter upon request of a patient. Teaching strategies include using natural speech patterns and not shouting, using simple sentences, and facing the client to allow your face to be seen. Visual impairments affect 20 million Americans and are caused by infection, trauma, disease, aging, and congenital causes. The aging eye may develop macular degeneration, cataracts, glaucoma, or diabetic retinopathy, and examples of each are on page 308 of your text. Teaching strategies include announcing your presence and identifying yourself, allowing the client to touch, handle equipment, using black and white large printed materials, using alternative instructional tools such as auditory or tactile tools, using a low vision specialist for adaptive optical equipment, and using computers with text-to-speech converters, braille keyboards, or screen magnifiers. Learning disabilities are a mixed group of disorders that affect listening, speaking, reading, writing, reasoning, or mathematical abilities. They include dyslexia, which is characterized by impaired word recognition, auditory processing disorders, which are conditions that result in the inability of the central nervous system to efficiently process or interpret sound impulses, and dyscalculia, which is the impairment of part of the brain involved in mathematical processing. Teaching strategies include providing a quiet environment, conducting individualized assessments to determine preferred learning methods and learning styles, involving parents if a client is a child, using repetition, asking for clients to repeat or demonstrate instructions, using brief teaching sessions, and encouraging active participation. Developmental disabilities include attention deficit hyperactivity disorder, intellectual disability such as Down syndrome, Fragile X syndrome and fetal alcohol syndrome, and Asperger syndrome, autism spectrum disorders. Public law provides special education, including early interventions for developmentally disabled clients, and establishes state councils, universities for excellence in disability education, research, and service. Teaching strategies include noting developmental stage, simplifying tasks, providing concrete examples, providing verbal and nonverbal cues, using repetition and praise, and encouraging participation of clients and their families and caregivers. Mental disorders affect approximately 20% of Americans and are the leading cause of disability in the U.S. and Canada for people aged 15 to 44. Although educating patients with mental disorders require the same basic principles of patient education, some additional strategies may lessen anxiety and increase readiness to learn. Teach in short and frequent sessions using repetition and simple brief words, and involve the client and their family's caregivers in the teaching learning process. Use their preferred learning style and incorporate positive reinforcement. One of the main physical causes that affect learning is traumatic brain injury, or TBI. The main cause is falls and can either be closed or open head injuries. Treatment of TBI can occur in the acute care setting and acute and long-term rehabilitation centers. Obstacles to learning include denial of degree of impairment, physical limitations, role changes, and feelings of isolation. Teaching strategies include group teaching, involving family, caregivers, and others with TBI to learn together. Focus should be on client safety and family coping, with short sessions with small amounts of information given step by step. Memory disorders include brain injury and tumors, Alzheimer's and Parkinson's disease, and depression. It may involve short-term or long-term memory or both. Teaching strategies include having the patient take notes, helping with a system of reminders, aiding in relearning the memory process, using vivid pictures, chunking information, and providing information in short, repetitive sessions. Communication disorders are deficits in perceptual and/or language abilities and affect the patient's ability to send and receive messages. Stroke is the most common cause, and aphasia is the most common effect. Aphasia may be global, which affects the ability to speak and understand language, expressive aphasia, which results in patients having difficulty expressing thoughts, receptive aphasia, which affects auditory and reading comprehension, and anomic aphasia, which results in difficulty finding the right noun or verb to convey thoughts. Teaching strategies for aphasia include acknowledging the patient's frustrations, speaking slowly in a normal tone, allowing time for response, and allowing the patient to see your face. Teaching strategies for dysarthria, which is impaired nerves or muscles associated with eating and speaking, include ensuring a quiet environment, asking questions that need only short replies, and using alternative methods of communication. Chronic illness permanently alters physical, social, psychological, economic, and spiritual aspects of a patient's and their family caregivers' lives. Teaching strategies include acknowledging the loss or change of roles, matching regimens to physical abilities, individualizing teaching and assisting the patient and family with adjustments and resources. Lastly, assistive technologies help patients with feelings of helplessness and isolation and may encourage independence and self-worth. Assisting with appropriate equipment and training and educating the patient on types of technologies available may help patients with almost any disability. Our role as patient advocates can go a long way in promoting health and aiding patients with long and short-term illnesses.